when you think about Baptist Health and the situation that we're in, our Little Rock Hospital, I've said this before, this is a place where the most expensive cutting-edge technology resides to serve people in all counties throughout the state of Arkansas and beyond the state of Arkansas. It's stuff you can't duplicate at every campus because it's so expensive, and you have to have a team of specialists around that service to make it work. So even if you have the technology somewhere, you don't have the other clinical caregivers there to support it. So at Little Rock, and if you go out throughout our history, there is that series of firsts that have occurred here. Well, a lot of those firsts happened here and hadn't happened anywhere else because you can't afford to duplicate that in a state like Arkansas in many places. And so having the foundation able to help support bringing those technologies, bringing those clinicians here, bringing those services here that ultimately benefit the state and beyond is really, really important. The most notable thing that's happened from a clinical technology standpoint since I've been here was actually pretty recent. A couple of years ago, we put in a total artificial heart into a young man from Northeast Arkansas who had no other treatment options, and saved his life, and he's still alive and doing well. And that was the first in the state of Arkansas, and there hadn't been one since, but it was a total artificial heart. We've done the LVAD program, which is a left ventricular assist device, which is when your left ventricle fails. We've done many of those over the years since we started a transplant program. But this total artificial heart was the very first. I mean, it was scary, and it was cool and amazing, and that was a huge deal. And it's weird to say that because it was one person, but we did it for one person, the first ever for one person, and it's pretty special to say that.